Okay, today we're going to be rolling a small pack, which would be used for small procedures, small growths, lac repairs, and neuters. I like to arrange all of my instruments into groups just to keep track of what goes where. These are going to be your essential instruments. This is a scalpel holder. This is thumb forceps. These are spay hooks, and these are your needle drivers. Here we have the two that look like scissors. The short fat ones are Mayo scissors, and the long skinny curved tips are Metzenbaums. Here we have our clamps. These two are Karmalts. We like to keep medium ones in the small pack, and then these here are going to be our small hemostats with the curved tip, and we like to keep small ones in the small pack. And then these here are your towel clamps, which we're also going to want to be small. When building a small pack, make sure to include a large amount of gauze as well as 4 needles of assorted sizes. I like to put the essential instruments first, starting with the spay hook because it's long and gets in the way, and then your thumb forceps and your scalpel. From there, I'll go longest to shortest, which would be the Mayo and Metzenbaum scissors, your Karmalts, your small hemostats, and your towel clamps. And I like to put the needle drivers on top because that's something a doctor will use in basically every procedure. To continue rolling your small pack, you'll first want to lay a small drape flat on the table. In every small pack, we also add an extra drape beneath our instruments. From here, every technician rolls a pack a little bit differently. The key is that as long as you have all of your tools and the pack is tight, it's okay. So you'll pull the bottom up first and make sure that your instruments are staying tight to the bottom. From here, you'll take each side. Some technicians will fold them. You can also just bring it directly across, making sure that everything, again, stays tight. You can do this with the other side as well. You will get a little bit of extra that I like to fold into itself so that it lines up with the end of the pack. From here, this is what I call the wizard hat. I like to fold each side inwards to itself so that it makes a triangle. And then I'll flip the pack around so that way I can really pull it tightly up against itself. And in that pocket, you'll roll the end. Okay, from here, you'll lay a second drape down and bring your pack to the center of it. Every small pack gets one surgical towel draped over the top. Again, you will pull the bottom tightly against the instruments. And for this one, I will make the little wings. It's important to make sure that everything is lined up and again tight. We have this little extra, so we'll just fold this into itself. Okay. Now here, what's important is that when you tuck this last piece into this little pocket, you want to make sure that there is just enough to grab for the next technician so that when they open it, they can open it sterilely and not touch anything that's on the inside. From here, you will tape it. The plain masking tape is cheaper, so we'll go one time around with that. And then we always want to mark it with the indicator tape so that way we know if it's sterile. If it's gone through the correct temperature for the right amount of time, this will turn black, indicating that it's sterile. For every small pack, you'll want to initial with your initials, SM for a small pack, and the date.